A very good evening to all the viewers at Kopi with Vets. And I am back as usual before the show starts. Coffee. And let me just enjoy first. Hope you all enjoying that as well. Coffee just gives you a kind of energy and the mood because it's all full of dopamine, right? It's some kind of drug, but it's legal. Yeah, it's legal drug, but it gives you a very booster, but you should not get addicted to it. All right, 1 cup a day, I think is perfectly fine. All right, thank you so much for joining Kopi with Vans. And today, a topic on the children's health, how much you know about them, and Dr. Praveen will be hopping on and giving his expertise as a pediatric. Over the past 12 over years, he's been in the intensive care unit of child, so you have seen many cases. And you also be going to come in and also to explain to us a little bit more on the allergies of food types, the kind of colds and fevers and kids have it. Sometimes parents, as we tend to take it care of our own self, right? Self medications, home medicine. But sometimes it is not very advisable because there can be certain allergies and kind of stuff. But before we go to bring doctor in, I'm going to talk a little bit on the adolescent transitional phase of growth, right? Because as an infant and all the way up to 18 years old, that's what pediatrics takes care. But you all are going to understand that development between childhood and adulthood, this is by the whole World Health Organizations, right? Defines as any person between the age of all the way as a baby, right, and all the way up to 18 years old is fall under the young people, right? They not fall under the whole people, but there's so many symptoms that we can talk about, right? Sore throat, ear pain, UTI, urinary tract infection, skin infection, bronchitis, sometimes pain, right, and common cold, bacterial sinusitis, cough, and there are many symptoms. But that I will leave it to doctor to come and talk a little bit more on that. But even enzymes as well, right? There's so many topics we can even talk about when it comes to child's health. You can imagine, I was just talking about this with doctor, that even as a child, right, they can't able to communicate with you when there's a ear pain. There can be so many symptoms that leading to ear, even wax build up as well, or some kind of a viral infection, or even for some kind of bacterial, whatever the situation can be. But the child is unable to explain to you about the ear pain because as they develop. So I think the best will be the pediatrics because they know all these signs and symptoms. So that's why today we're going to come in and ask Dr. Praveen for all that. But I'm going to talk a little bit on the what I observed in the past in my 15 years of my career or 22 years of career, even with parents that I talk to when they come for trainings in terms of physical fitness. But sometimes there can be allergies on food, which I'm hearing most of the time, right? Like eggs, milk, peanuts. Most of the common causes of food allergies in children with wheat as well, right? Sometimes they can't take wheat. There's some kind of major reaction that happens to them. Even soy. That's why you see in the plains, sometimes they give nuts to children accidentally, and there can be a very major issue with them, like allergies or even skin reaction. So even shellfish or seafood commonly causes the most reaction as well as when they take it accidentally, or when parents are actually trying to explore what is the symptoms and signs. That is where you got to connect with your pediatrics. All right, I said enough. I'm going to pull up Dr. Praveen here, but I'm just going to talk a little bit of Dr. Praveen's journey, because he's going to do his introduction because he's my guest speaker. But he has been graduated in 2006 as a doctor, and then his interest practiced a few more years, and then he wanted to. There must be some kind of passion, towards kids. So I'm sure Dr. Praveen loves children. I think that's where he is right now. And he was a pediatric from 2009 all the way up to right now. I had a very great conversation with him, and he was telling me certain of the cases that he handled. So it can be a very not interesting, but I was going to say it's very intense, because he's the man who is always there at all, right? 24 hours of calls. And I think we also want to know about his lifestyle, how he takes care of himself, because he takes care of our children, our loved one, but then he got to take care of him because he's the man as well. So he's been currently practicing in a hospital, which I let him to do the introduction, as an intensive care unit, where ICU, where he is. So let's get Dr. Praveen out. All right, Dr. Praveen, you are coming up, sir. Where are you? Hello,
Hi,
doctor.
hi, Vance.
How are you there?
I'm good. I'm good. Nice to see you.
So, as usual, in my show, there must be the coffee cup. Let's go
Oh
waste your coffee.
yes. Here
You
you
got a
go.
coffee? All right, cheers. All right,
Cheers.
cheers to the viewers as well. All right, doctor. Thank you for joining in Copy Events. I took a couple of minutes of a basic introduction. Of course, you
Yeah.
have heard about it. But before we even dive into the topic of today's topic, your child's health, how much you know about them, right? Before we even go there, what makes you want to work with children, doctor? I mean, most of the parents, most will find that children are very, with so many variations of status. But as young, they cry and unknowingly, and you be always be in that parameters of crying and screaming and constant. There might not be a constant flow of peace. I already to say, but it's of course not. How do you manage that? What makes you in that interest to become a pediatric?
That's a very good question, Vance. Actually, I guess first of all, I got into medicine because I like science and I liked working with people. And when we start off, we always have this little bit of kind of altruism and okay, right. I went into pediatrics because I like working with children, and you see my son over there.
Yeah, yeah, he's your assistant. He's been
Yeah.
talking to
So,
you.
and I guess I wanted to spend my time making children feel better, and that's something that's very rewarding. Sometimes in pediatrics, children come in very sick, but they're very strong, and a lot of them get better very quickly. And within a few days, they're running around the ward, pulling down the signs and everything, and that's nice.
Okay, so you love kids.
Yeah, of course. Yeah.
Okay. Thank you, doctor. I mean, first of all, I know you are having a really hectic schedule. When we did our trial and we did a discussion as well, I know you're always on standby, and thank you for joining even the shortest period of time to share this particular topic, because I think there is a number of quite significant cases even both in Singapore and Malaysia. I think parents are always constantly in a question mark, right? They're always finding out answers for questions they might have it. But I think because as a parent, you don't go for a course, right? You don't go for your diploma parenting and degree in parenting. You don't. It's all
No,
on the go. Trials and
maybe we
error.
should.
So I think it's difficult, right? So if you ask me, I mean, even I myself, all right, I mean, three kids. I think it's not pretty easy. But my wife has a degree in parenting because she does most of the job. Hopefully, she's hearing that.
Yeah.
But what I want to ask you, doctor, before we go into the slides, being a parent, I think is very very challenging because they're always exploring, and based on that, most of the time they do self medication and wait and see. I think that one we're going to cover in the topic. But what is your take, doctor? I mean, as a parent, and if they have any doubt about the kids, do you think they should go back to the grandparents and say, oh, this kind of situation, so and so forth? I think which worked, but with current situation, all right, with so many viruses and so many situation, antibiotics, we can keep on talking about it,
Yeah.
allergies and enzymes and blah blah blah. But what is
Yeah.
your take on that?
So actually, that's a good question. I think whenever I tell my team also, whenever we are struggling with something, when we're not sure, it's always a good idea to ask for help. And rather than struggle alone, you get a friend, get somebody who can help you, preferably somebody who's got some experience or some training in that field. So sometimes grandparents can really, they've seen it, they've done it before, they've been through it. They can give you some tips and help to solve the problem. But of course, when children are really sick, it's always best to get someone who really knows what it's about and how to treat them safely. So I think if parents are worried about their children, they think the child is seriously ill, it's always a good idea to get some medical advice. And I think just the fact that a parent is worried always makes me worried, because parents know their children best. I might know the medical part, but nobody knows the child better than the mother and father. So they say,
Doctor, like what you
absolutely,
said, is,
yes.
I totally agree with you because I was doing some research as well before our topics, any topics, I do some studies as well. How does maybe say 18 months baby complains about a ear pain? How do you find that? How you know that
Yeah.
there is some ear infection? How do you look at the baby and say, okay, it could be the ear infection? How do you have that kind of feel, that the kind of magical expertise you have?
Yeah, I think some of these things you just can't just study it in a book. You get a bit of it through experience. Sometimes the parents will tell you they're worried. I see some little bit of fluid coming out of the ear. The child is always pulling the ears. So things like that can give you a clue. But actually, when it comes to a baby, sometimes you just have to examine them very carefully, from top to toe. And sometimes all the baby can do is cry, cry or not feed well or have a fever. So you really need to, they can't tell you, oh, doctor, I've got this pain here. I think my ear is infected. So it's challenging.
More sounds like a baby whisperer. You look at the baby and the baby communicates with you, right? Dog, look at my ear, dog, ear, dog.
Yeah.
It's a good one, doctor. So,
Yeah.
thank you for that particular thing that you did introduction. You want to talk a little bit about yourself, doctor, before we jump into the main topic? I mean, your expertise as a pediatrics, and we know that you love children, and you just mentioned that it's how you actually observe the sign and symptom, which is great. But
Yeah.
what makes you become a pediatric? I mean, is there a particular reason, and why not maybe endocrinologist or cardiologist? Why specifically a pediatrics?
Yeah. That might be a bit controversial. I guess the main thing is interest, lah. So when I was in medical school, I got to learn all the different parts of medicine, orthopedic, surgery, and things like that. And I found I really loved the pediatrics. I loved going to the ward, seeing the kids. Initially, it was difficult when I saw children with cancer or children who were very sick. It affects you, and if you're not used to it, it can be quite disturbing. But over time, I found that I really liked pediatrics. I found that I could do it. I was okay at doing the work, and then I decided to sit for exams and study hard and try to be a pediatrician. So to tell you a little bit about myself, I went into medical school more than 20 years ago now, and studied in in University Malaya. I graduated 2006, and then I worked in Kuantan in Pahang, the eastern part of Malaysia. After that, I got to work in Cameron Highlands for a while. That was a beautiful place. You should go there. And then I came to Ipoh, where I work now, and I did my training in pediatrics. So I worked as a specialist for a few years. Then I did some extra training in pediatric ICU. So now I'm called a pediatric intensivist, which basically means I look after children in the children's ICU. And I've been doing that for the past few years. It's a growing field. There are not many of us in Malaysia. I think, including me, there are probably like 16 of us in the country. And unfortunately, in my state, I'm the only one. So things can get a bit busy. But we're getting more and more people interested in it, and hopefully, there'll be more of us around soon.
Thank you, doctor. I mean, for doctors and nurses, I think there is a very meaningful job that anyone can do. It's definitely about passion. It's
Yeah,
even though it can be dollars and cents. I mean, at the end of the day, everyone's have it. But I think doctors and nurses are sent out by from the top as angels to take care of the human beings we down in earth, because there must be a kind of passion. I mean, of course, as the profession grows and the interest also develops. So thank you so much for that professional that you're doing and taking care of the kids.
thanks.
Doctor, we shall dive into the topic right now. And
Sure.
to the viewers out there, just hang on, Doctor. To the viewers out there, please, if you're watching this, please do share this video. Kobe with Vance and Dr. Praveen in conversation about child's health. We're going to talk about enzymes. We're going to talk a little bit on the kind of symptoms and signs with doctor. So it will be very useful for parents to actually to watch this. All right. So thank you so much, in advance. So please do share this video to your Facebook and to your friends and families, so that more people can come in and we can have great questions at the end of the day. And we will also have a guest speaker at the end of the session to give us some COVID situations and so forth. So he's standing by. He'll be coming in soon. So, doctor, the show is yours. The light is on you. Your PowerPoint slides, doctor.
Great, thanks. Let me share those.
Right, we got some viewers. Thank you, Sita. Thank you so much for joining us. Thank you, Leah. And thank you, Ramesh Pillai. Thank you so much. Please share the video, guys. Thank you so much. I appreciate that. The more, the merrier, right? And if it reaches to more people, and it will be definitely be beneficial. All right. So while Doctor is getting out the PowerPoint, today's topic is going to be on child's health. We're going to talk on different topics that we have already planned and designed for them, for the topics to come in, so we can actually start. All right, Doctor.
Okay, thanks, Vance. Can you see my screen?
You're going to press the share screen, Doctor. Then I can.
Sorry, let me just do that.
Thank you for all who just tuning in. Thank you so much, Jacinta, Carol, Navita. Thank you so much. Thank you for joining in. So please share the video. I'm going to pull up the slide now in, Doctor. All yours.
Okay, thanks. Vance, can you see my slide?
Yes, Doctor, I can see you. And I can see the slide as well.
So, thanks. Actually, this is one slide with a few words in Malay.
Okay.
The pictures are actually quite what I want to talk about. So, one thing that I think is useful for many of us to know is what are the danger signs? When do you need to be worried? When do you need to bring your child to see a doctor? Nowadays, a lot of us are worried about COVID. You know, we don't want to unnecessarily walk into a hospital or a clinic, a crowded place, and all that. So but there are certain times when your child is unwell. There are certain times when you shouldn't delay. So one of the things is if they're having a high fever and the fever doesn't go off, if it persists for 3 days or so, or if they're vomiting, they have continuous vomiting. So these are danger signs. These are things that tell you your child is not well, and you probably need to bring them in. Or if they're not passing urine, if you have a small baby and the diaper is just dry the whole day, that might be a sign that the child is not well, is dehydrated. Or young children, if they're not feeding well, they're not drinking anything, everything that they drink is coming out. Or if they have got blood in their stool, they have got diarrhea with blood, or if they have fits, the first time the child has a seizure or a fit, all these are danger signs. All these are signs where you want to get medical attention now, not delay things. And also if they've got difficulty breathing or they are very weak and unconscious. So if you see a child with any of these signs, it's time to go to the hospital. Okay, and the other thing that's not in the picture is if a parent is worried. If you think your child is not well, you're not happy about something, then it's a good idea to just pick up the phone, call a doctor, call someone with some experience looking after children, and just make sure that they're all right. At the end of it,
Doctor, sorry just to cut cue here, but I think definitely, because I think parents nowadays are very worried. I mean, when it comes to kids, because of course, right, they're loved ones. For little things, I think it's very important, because whenever they feel that isn't something wrong. But if a child just cries constantly without stopping, and that could be a sign and symptom, which I think so. But what is the main cause over it? Maybe stomach, so many things can happen at a time. But how do you just, look at it, put some stethoscope and looking at it, and, like you said, but how do you gauge this situation? A child just constantly crying, non-stopping. Yeah. What is your take on that? I mean, how do you?
Actually, that's something that can be a sign of serious illness. If the child is crying non-stop, it could be because the child is feeling some pain and they can't tell you where the pain is. If it's a small baby, sometimes it's because they're hungry, because the diaper is dirty, or they're feeling cold, or anything that causes discomfort can make a child cry. But if they can't be consoled, if they go on and on crying, then it might be safer to just take them to the nearest doctor and make sure nothing is wrong. If you've checked everything and the child is perfectly fine, then sometimes you just need to give them a little bit of time, keep them safe, and wait for them to stop. All babies cry. It's not normal if a baby doesn't cry at all. But non-stop crying can be a danger sign, and the safest thing is see an experienced doctor and make sure the child is all right.
All right, doctor. Thank you so much. So we can proceed on to the second slide of yours.
So this slide is just to remind us that there are other things that may be actually more dangerous to children than COVID. Right now in the whole of Malaysia, there are very few children who are really very sick from COVID. But in adults, it's a different story. A lot of adults get very ill. But there are other diseases that kill many children. Like TB killed almost 600 children every day in 2015. And 2018, I think more than 200,000 children died of TB in the world. So sometimes we think these diseases don't affect us and they're not very serious, but they do take a huge toll. And then even things like depression, mental illness, all this can affect many children, and it can cause harm. And something we do see in parts of my country and around the world is malnutrition. So some children from the poorer communities, indigenous people, some of them come in with severe malnutrition, and they can get very ill as well. So these are just some of the other things that are out there, and sometimes when we are so focused on one bug, we can lose sight of these other things, and they're also important. Just moving on, I guess the hot topic these days is COVID-19, and this is from the UNICEF website. So they say that children, although they may not all get sick from COVID, but children can be among the biggest victims of this pandemic because their lives are being changed. Even if they are not directly getting sick from COVID, they are affected by socioeconomic issues, the lockdowns, the school closures, and then when they're stuck at home, sometimes they have issues with abuse, mental health problems. They feel isolated and depressed, and they're struggling to cope. And UNICEF says that this is a universal crisis, and it may have a lifelong impact on many children. And so that's something that we need to kind of keep in mind. One of the big things is education. I think not just in Malaysia and Singapore, but around the world, the school closures, going on to electronic learning, digital kind of education, has created challenges, especially for the children who are in remote areas. In Malaysia, you've got children in remote areas who have to go very far away from their homes to get internet access. Sometimes families can't afford to get electronic devices for many children, and these are challenges that a lot of countries are facing. And if you look at the graph here, a lot of children across the world who may not be able to have access to internet and remote learning, and this is creating problems. Another huge thing is the effects on nutrition. For a lot of children, actually, not in the higher income areas, but in some communities, a lot of children get their best meal when they go to school. School meals are a source of nutrition, and you make sure that the children get one good meal every day. And when you have lockdowns and school closures, a lot of children can be put at risk for malnutrition. When the parents lose jobs, they're out of work, they can't provide for their families, and we found that COVID-19 is causing a lot of poverty, and the nutritional status of children across the world is getting worse. So I guess the impacts of COVID-19 are actually pretty serious.
Doctor, just going to pause you for earlier. I mean, with this pandemic, and of course, in Singapore, we're going different stages, right? Stage 1, stage 2, stage 3, and things are getting better. And of course, Malaysia was also getting better. And then, there's some challenges. And every country have their own challenges. But, you brought a very interesting topic that children nowadays, especially in this era, could have an impact in the future because they're supposed to go to schools, they should be happy, and so forth. But right now with the MCO, with even in Singapore, there was a circuit breaker as well, with minimum circuit breakers, and even in Malaysia as well. But as a child, you should be happy and out going to schools and kind of stuff. Without that, even for a short period of time, I think it has been like snatching away their happiness for a while. So psychologically, they could be affected in a certain area. Have you seen any cases where children or child, where anything from 9 years from all the way up to 13 years old, having these kind of symptoms currently? Because there has been cases that people are going through stress. And we about a few weeks back, I had a topic on mental issues, right? We talked with a neurologist and we also talked with a psychiatrist and a group of counselors. So there was a significant number. Of course, it's very sensitive, where they took their life away. So this is for the adults. If adults can do that, it can happen to anyone. What kind of impact will children will have? Will there be like emotional stress or physical stress, psychological stress? Would there be an impact, doctor, as a kid?
Definitely, Vance. I think I've seen it myself. I've had a child who came to my clinic and, he had a heart problem. We were all talking about a heart problem. At the end of it all, he asked me, can you refer me to a psychiatrist? And I asked him why. He said, I'm very depressed and I feel like killing myself. So I got a shock. He came into a clinic to look at his heart problem. But the whole impact of the lockdown, the school closures, COVID, I guess the stresses that his family and all going through, it just had a huge impact on him. And he's not alone. There are many, many children and adults who are struggling with mental health issues. The isolation, these are extraordinary times. It may be okay for some of us where we've got our families with us, we're not so isolated. But for some people, if they're living alone, they can't interact with people. It can get very lonely, very, very difficult. And children are part of this. I think the impact of COVID is like an iceberg, like 90% of it is underwater. You don't see it. But the social, psychological impact, the emotional, financial, there's so many things where it's impacting all of us.
I got to agree with you 100% on that. Because in the past 1 over year, especially with Kopi, with Van's channel, like I said, we have many subject expertise who came on board, just like yourself, doctor. One thing that I learned for sure, that there is a very, not one shirt that fits everyone. So it's going to be a big challenges. But I've also seen in the adults where I personally felt that, 14 days quarantine in a room, especially if you're coming from other countries to check, make sure that you are not infecting others. So make sure that you're cleared and do all the COVID tests and swab tests and kind of stuff. But that 14 days staying in the room also causes a different kind of fear. Some might have a claustrophobia, but some is like enclosed where you don't get your sunlight, you're not communicating with your loved ones, you're not saying I love you to your wife or children, you're not hugging your parents, and there's no social bonding. So when the social bonding is not there, automatically the mind just gives up and creates so much of fears and factors along the way. So I think adults are also facing the current situation of a different level. It's just that adults are way much more easier to wear a mask and then say that, I'm strong. But unfortunately, at the back of their mind or the back of the main complex machine, they are pretty much going under a stress mode. So I think I totally agree with you, doctor, that COVID actually tested everybody, their resilience, their determination, and to a certain level on financial factor, push them through obstacles and challenges. So I think it's not going to be same for everybody. It's got different challenges and on their plate. So I think everybody just have to overcome it as a cohesion and help each other. That's the only way we can climb up. It's not just about the strong ones going on the front and leaving all the weaker one. That's not going to happen, because that is going to create even a recycle issue that's going to be a longer number of years going to come in.
Very true, Vance. I think we all need to look out for each other, and we need to see other people's need as well. Not just look at where we are, but you've got to hear people who are crying out for help and reach out to each other. we can't leave everybody else behind and forget about them.
Agree, doctor. Agree. So we should go on with the third slide, doctor. I mean, with this slide itself. Yeah.
So this is a disturbing slide, and sorry to share these images, but I guess it's a big issue. Even during the lockdown, we saw a bit of a change in the pattern of children who are being admitted to ICU and all. And because all the children were staying at home, we didn't see so many road traffic accidents. You don't see motor vehicle accidents and that kind of trauma, but we saw a lot of inflicted injury or child abuse, and across the world this pattern was there. So when children are at home, sometimes when families are going through emotional stress, you can get an increase in domestic violence, and it's difficult for vulnerable people to get help because they're not allowed to leave the house. So and our social support systems, the welfare officers, the people who usually protect children, they're also on lockdown, so they can't easily go out and see how the families and children are doing. So this is a challenge that's happening all over the world, especially in Asia. If they look at around the world, the countries where a lot of the services for child protection and all were disrupted it's predominantly in the Asian countries. So it's a huge challenge, and we really need to keep our eyes open. There are ways to reach out. In Malaysia we have these helplines. Like child protection thing called Talian Kasih, and the welfare phone numbers and all that we can call. And it's a challenge to keep our children safe. What do you think, Vance?
I think we just we are blessed in every angle, doctor. That's all I can say. That I mean, sometimes we don't look at the situations in other countries, even for the matter of food or water, or even the environment or the political system, or even for the fact of the financial growth in that particular country. Just to share a little bit of story that I've faced. I did an interview session, a talk session with a gentleman from South Africa. He was actually having the 10 days quarantine at his home because he was infected with COVID-19. So he was doing an interview, but unfortunately we cut the interview short because that interview is supposed to be at 45 minutes. The interview only lasted for about 20 minutes because he was coughing and kind of stuff. Because at his particular country, I mean, of course, like I said, every country have their own challenges. At that point of time, he was sharing some thoughts and some sharing sessions that how that particular country was not having enough support, or in terms of medication, in terms of hospitalizations, and so on and so forth. So when we look at these kind of situations, sometimes we just have to be very graceful and very blissful, and at the same time, we got to look after our fellow mates, wherever within our means. So I totally agree with you. During this particular situation or this pandemic, when the lockdown was there was a significant number of increases in divorce rates because everybody just enclosed it. Violence-wise, also it took place because there's so much of stress going on. Uncertainty is the main cause of stress because you're not sure of the future. A lot of negative thoughts came into the mind, and fear. I think fear is also another part of failure. But when you focus on the positive side, we can easily say that. But the financial side, where they also worry for their families, right? What's going to happen? I mean, everybody should be responsible. I think everybody went through a stress, but if we let the stress hormone, the cortisol, to override us, then eventually it just destroys us. So we need to find ways to outlet that out. So I think which is one of the best things is just meditation, which is we don't need to follow any religious or religion, but we just have to sit down and calm the mind. But then it's a big challenge for some, just listening to music, do something, how worse can it be, right? What is the worst? The world has seen so much of huge pandemics over the past 30, 40 years, right? Because we saw the H1N1, we saw the swine flu, there was a lot of other stuff that came in the past, right, Doctor? So I think this is again a challenge for all of us, and we need to do as a cohesion and then bring this forward and helping each other along the way. And I totally agree with you what you have said, Doctor.
Yep. All right.
Thank you to all the viewers, which are constantly the messages are coming in. Dr. Praveen, I said you are quite famous in your e-post because a lot of them are saying so. Thank you so much to all the viewers. Thank you. All your love and your messages will definitely will be a booster for Dr. Praveen to push it. So we have a lot of viewers that came in. Thank you so much. Thank you so much. Please share the video so that Dr. Praveen messages can spread out to many other people, not only in Malaysia but in Singapore. At the moment, we are just focusing in these two countries, but eventually we are also looking at overseas as well. Thank you so much. More messages are coming in. In the last 20 minutes or 30 minutes of the show, we will have some Q&A. I know some parents have already sent in their questions, which I will ask Dr. Praveen. Please feel free to bring it out on the messages so that we can even talk about it. Please stay tuned all the way till maybe 1 hour, 15 minutes, because we have a guest speaker, Dr. Arvinda, who is a subject expertise in COVID-19. So he's coming in to give us some of his research and the same time on statistics on both countries as well, because he worked with Singapore and Malaysia as well. He working on certain statistics. I call it the doctor statistics because he works very deeply with that with a great passion. So we will come back with that. So now let's hand over the show to Dr. Praveen. So Dr. Praveen, you can please go ahead with the slides.
Thanks. So I guess bear with me. I think we're just going over things that all of us are familiar with now. During this pandemic, these are some of the things we need to do to keep safe. So washing your hands often. This particular virus is interesting because the easiest way to kill it is with soap and water. The virus has a lipid layer of fat around it, and soap just destroys that layer and kills the virus. So it's actually quite easy to kill the virus with soap and water. So if you wash your hands frequently, use hand sanitizers, you can actually keep yourself very safe. And wear a mask. So I think the clear message would be just wear a mask whenever you can. And especially when you're going out, you're going to any crowded areas, confined spaces, you can really reduce your risk of getting infected and your risk of passing any infection to other people by wearing a mask. And this is tough, but we need to try to stop touching our face too much, because if you've got virus on your hands and you touch your mouth and nose, that's how it gets into your body. The other things are basically to cover your sneezes. So if you sneeze or cough, try to cover your mouth and nose. And cleaning your electronics. So a lot of us may not be doing this as often as we should, but there are safe ways to actually clean and disinfect your phone. And if you're going to write something, it's always good to have your own pen, so you don't have to touch some writing equipment that a lot of people have been using. So all these are just some of the safety tips and things that we have all been practicing.
Doctor, I got to tell you this, right? In the year of 2020, it's a very memorable experience because all of us, what we did was washing our hands with soap and water, and that's all about it. And sanitizers, right? Sanitizers was sold out worldwide, right? You can't even find sanitizers, and then all of them have to do improvised sanitizing and kind of stuff. Wet tissues gone. So we were doing was just washing and washing and washing and washing. So memorable 2020, right?
Really, it's a clean year for us. So I'm almost done with the slides. So this is just a picture of the big 5 animals in Africa, the lion, the rhino, the elephant, and all that. But more relevant to all of us, Vance, you mentioned self-care, when you introduced the talk today. And I think more and more it's important for all of us to be able to look after ourselves and to take care of ourselves. If you want to help somebody else, first of all, you need to help yourself. And so there's this website called learningfromexcellence.com. One of my friends and mentors in the UK introduced me to this. And so these are 5 kind of concepts that they're using in this center in one of the hospitals to just help people get through this. And number 1, they say you're not alone. This is a weird, extraordinary thing that we're all going through. None of us have been through a pandemic before, and it's okay to be afraid. It's okay to be a bit uncertain, but you're not alone. We're all in this together. And even with physical distancing, I think this pandemic has brought the world closer together. I've joined talks with people from Mexico, from the US, from the UK, and we share ideas and we have these virtual meetings. Vance is sitting in Singapore, and I can talk to him today. So we're not alone. And number two is kindness will get us through. So I think it's important, however stressed we are, however worried we are, to remember to be kind. Not just kind to our patients, to our colleagues, but also kind to ourselves. And a smile can really make a huge difference. I have to remind myself that sometimes things get stressful, but kindness, being kind can actually improve a lot of things. Embracing the challenge, we're all learning new things. I don't think we're going to practice medicine the same way in the world ever again. COVID has changed the way we control infections. The masks are here to stay. Hand washing has gotten better. We're using things like face shields, and we understand more about how to prevent infections. While we've been fighting COVID, the other viruses and bugs and all have also been coming down. So across the world, we're seeing a drop in infections, and as I said, things like the road traffic accidents, when people stay at home, suddenly there are no more accidents and all that. Then looking after each other and looking after yourselves. So as we are working to help other people, we also need to make sure we care about ourselves, and we can do this. I think we're up to the challenge. The human beings will beat this thing. We've been surviving on this earth for so many years, and we will get through this. So just wanted to share the big five with all of you.
Thank you, Doctor. Thank you for the big five. Thank you so much. We have already a couple of questions that's already lined up for you, Doctor. So we got to answer them. But before we answer them, we have our guest speaker. And before I bring our guest speaker, I got to say one thing that there's so many people that are constantly sending so many messages, and so many questions are coming in. So thank you so much once again. And I can see the sharing of the session is tremendous. Thank you so much from the bottom of our heart, because I think this is a topic where a lot of parents sometimes not misjudge, but somehow or other they might not know what is the best. So thank you so much again for sending all these lovely messages and sharing our video. I'm going to bring up our guest speaker, Dr. Arvinda Aap, who is an expert on the subject of COVID-19, and he's also a GP. So let's get Dr. Arvinda. Dr. Arvinda? Hello, sir. How are you?
Hi, good evening, Vance. Hi, Praveen. How are you? I'm fine, sir. How are
Okay, we are getting some distortion
Hi,
from
Praveen.
Dr.
How are
Arvinda.
you?
Okay.
I'm good, Arvind. Nice to see you.
Okay, so I think your
Thanks,
connection is
nice
a
to see
little
you
bit
also.
down, Doctor. How is it?
Okay, maybe you
Your
can go to
connection is
Praveen
okay?
for a while.
Okay.
I'll
You want
just
to sort out
hook up. I will hook up to the broadband.
Okay.
Yeah,
Okay.
just give
So we
Praveen
have
some time.
sure. So, Doctor, we're going to go to the answer, the questions right now. I have Deepam here. Hopefully, she's online as well. She said, "The doctor, can babies with severe colic be dangerous to the child?"
So that's a good question. It's a challenging question. My own baby a few years back was crying, and I was searching high and low for ways to stop him from crying. But as you can see earlier, he joined us. He's well now. I guess the most important thing is to make sure there's nothing seriously wrong. Make sure baby is not in pain. Make sure is feeding well. Is able to pass urine, pass motion. There's no signs of infection. Once you've checked everything and everything is fine, sometimes you just need to wait for the baby to self-soothe. Sometimes in some children, when they're very young, they cannot soothe themselves. Their ability to stop crying is still not mature yet. So that in that situation, when you're alone with the child and you get stressed out, the baby senses your stress and gets more stressed out, then goes on crying. So if you have a friend or a relative, somebody who can just take the baby for a while and hold them while you go and take five, you take a break, have a cup of coffee with Vans. That kind of thing can really make things easier. When you calm down, the baby will sense that, baby will calm down. There are some, things like gripe water and all, some remedies that might help to soothe the tummy. I just have to say that breastfeeding babies tend to have less problems with colic because they don't swallow so much air. And so those are things that can help. And if you're worried, maybe just go to a doctor that's experienced and just make sure everything's okay. Right?
Thank you, doctor. And we also have a few of comments that came in. Say, well said, doctor. We are in this together. Class. He put in as a comment. And J3 and also Ramesh have said that. J3 has said very informative session. And say thank you, Dr. Praveen. And more messages are coming in. I have a message, but before that, let's see if Dr. Arvind has sorted out his connection. Dr. Arvind, are you there, sir?
Arvind, you there?
Okay.
Hi, I'm here. Better now?
Yes, so much better.
Now?
So much better. But yes, but there's some still lagging, but I still can hear your voice. Can you hear our voice?
Yes,
okay,
clear,
so okay. So Dr. Praveen, we have a question from Cindy. So Cindy said, my child has an allergy for nuts and wheat. Will there be a possibility that I can give these two, which is of course the wheat and the nut, in the future?
Okay, that's a difficult question. It depends what kind of allergy the child had, and including like what age the child first developed the allergies. Some children can outgrow allergies. That means they have problems taking the food when they're younger, but over time as they get older, they can tolerate it. But if the child had a very dangerous reaction, like couldn't breathe, the face all swelled up, and they went into shock, fainted, and things like that, then I wouldn't recommend trying that at home, usually, if they want to do something called a food challenge, at a certain age, they'll admit the child to the hospital, give a little bit of nut or a little bit of wheat and see whether the child is okay, and then slowly increase. The most important thing is make sure the child is safe. You don't want to have a severe allergic reaction that can endanger your breathing or your life, and that's it. So I can't really answer the question without knowing more about the child. I would suggest just talk to Cindy's doctor and or Cindy's child's doctor and see what he says.
Thank you, doctor. Thank you so much. So viewers out there, the questions are open up right now. Well, Dr. Arvinda is going to come in as well. He's sorting out his connection issue at the moment. He's a great subject, expert subject on the topic of COVID-19, and he does a lot of statistics. I enjoy talking to him very well. Dr. Praveen enjoys talking to him very well. It's a very down-to-earth doctor. So let's see what he has to say. I'll try to pull him back. For viewers who are watching right now, thank you so much, because there's been a constant flow of viewers watching it. It's my greatest gratitude. If only you can just share the video to your Facebook as well, so that more friends and families can actually revisit this video, because it is going to be posted in our social media, Dr. Parveen's Facebook, and Kopi with Vans, and Banan Goinda Sami, which is my Facebook. It will be there, so it will be great if people more come in, and then they can ask us a lot of questions as well. So, Doctor, well, there's a couple of questions there, and I'm going to ask you something. This is my observation, right? And my questions are going to be very, very difficult, because I have planned them for you. I don't know, some or other, for all my 3 kids, that's a particular doctor, Dr. Vela, in Singapore. Some doctors are just like that, right? You bring the child, the next day the child is recovered, all right? In the Tamil, they will call it as kairasi, and luck, something like that. Sometimes you just go and see the doctor, your sickness just goes away, right? Or I call you the baby whisperer. You come and see me. And what is the relationship between these two? One is medication, one is passion with love and genuine of helping. Is there some kind of vibration, or is it some kind of the communication? So what kind of relationship is that? Once a doctor in, the sick is gone, especially for kids. The baby can cry, right? But once you go and see the pediatrician, gone, she stopped crying. What is the relationship within this?
I wish I was a doctor like that. I have to admit, I'm not at that level. But you're right. Some people just have this healing presence, and some of them are doctors, some of them are teachers, some of them are fitness instructors. There are some people who their personality is just such that after talking to them, you just feel better. You feel better about your life. You feel better about the world. And if you know people like that, just cherish them and be grateful. I think it's a gift. Not everybody can learn it. Not everybody can do it. But you're right. Some people just have that healing touch and that healing presence. And you just feel better when you have them in your life for a while. It's
Thank you, Doctor. Thank you so much for that. I'm going to take one more question in, and before I'm going to get Dr. Arvinda up. So, Dr. Arvinda, just hang on there. I'm just trying to get one of the questions that posted by a viewer just not too long ago, and I hope that she's still there. But I think that is pretty. Let me see. Oh, just give me a minute, Doctor. It's coming in. Okay. Okay, this is a little. This question is a pretty much more, I gotta say, is based on medication. But of course, it can be because, I mean, honestly, some do self medications. If you're having a sore throat, probably you want to have some rasam. If you have flu, have rasam, or cold. It's medications, and you're being tired, you just drink with water with palm juice, and so on and so forth. There are many medications, but what works for them, right? Yes, but doctor, this particular question that asked was, is a medication pill, right? Is it a slow poison?
That's a good question. Actually, all our medicines are poisons. It just depends on how much you take. You take enough Panadol, it'll kill you. I guess every medicine, it's a medicine because somebody knows the right dose to give the right patient at the right time. You give the wrong dose to the wrong patient at the wrong time, you can kill them. And some medicines are more dangerous, like the cancer drugs and all. You have to count them down to the last milligram. If you get it wrong, you can kill the patient. If you get it right, you may cure them. And even oxygen in too much quantities can kill. So the anesthetists will say that's the irony of it. Something that we used to save so many lives can actually, if you give too much, can kill people.
Thank you, doctor. I hope that was answered that for you, Alicia. All right, so we also have Vijaya, who said it's about building relationship with the people around you, doctor. So, doctor is quite famous here today. Lots of love pouring down. Thank you so much for all those love and messages coming in. I'm going to try and see if Dr. Arvinda, we pull him up for the third time. Dr. Arvinda, jump in, please.
I'm here, right, man. My net is okay now.
All right, now you're better. Okay, doctor, thank you so much for joining again as on the last part of the talk session as our guest speaker to talk about COVID. Maybe you want to give us a very quick update on what's happening in Malaysia and probably in Singapore as well. I know probably you might not have the stats for Singapore, but I know in the initial stages you mentioned to me that you was looking to the numbers as well, which is very useful for the viewers in both in Singapore and Malaysia as well. Doctor, I leave it to you for the next 5 minutes while the more questions are coming in. And we still have about 15 minutes more before we're going to end our talk show. In fact, under the pediatric parameters, there's so much thing that we can talk about: medication, allergies, certain kind of illnesses that no one will wish upon. So many things, all right? But as much as we can, we try to answer these questions with both doctors here, with their subject experts. But in the meantime, maybe Dr. Arvinda, you want to give us a quick stats, doctor, about this, how this Mr. COVID or Mrs. COVID is doing right now? I do not know what it's all about.
After coming on your show, people know me as COVID Singh, so it's okay. Anyway, but I just want to share with you, I do have the stats for Singapore, but honestly, I think it is not worth looking at the numbers in Singapore anymore right now because I think they have got it under control. The pandemic seems to be well controlled. And if you remember the first appearance in your show in March, I said that Though the numbers are exploding now in Singapore, trust me that it is going to be much, much more controlled before we can get it out of control. And I think during that time, Vance, if you remember, I showed you, just let me share the screen really quickly. I showed you a graph which looked like that, Vance. And as you can see, a lot of us have been looking at this graph. Is a competition between Malaysia and Singapore, but at the end of the day, even though you think that the R naught is Singapore is higher, but it is not already the best indicator to actually show how the COVID-19 is working within these two countries. And we would like to look at the dispersion and, of course, the number of active cases. I also would like to just share with everyone that it is one moment. If with this particular one I'm going to share with this screen, I think it is important to know that it is not the numbers that matter anymore, but the percentage of positives. You see, Singapore has run many, many tests over the weeks or 1 week, and I know Singapore releases their testing statistics only 1 week once. But as you can see that we are looking at the positive percentage. Even Singapore may have done 30 or 40,000 tests, they get about 30 positives. That means the positive percentage, the number of positives for tests done is very, very minute. Malaysia, we are still running at nearly, I would say, I think up to yesterday was 6.2%, which is quite high because WHO has already told us that 5% is where we have to start mass screening, and I think we have to go that particular way at the moment. Let's be frank, you test more, you will get more numbers. But what numbers do you get? Whether you get tier 3, tier 4, tier 5 patients, because those are the patients which actually end up in the ICU. And if you look at this, most of these ICU patients and those people who are actually ventilated, these are the patients who actually will end up with mortality and death. So that is why we are actually very worried about it. And if you see that every time that there's a small spike here, the death also spikes. So the rate in ICU and the rate in ventilations are the ones which actually causes the death, and that is what we actually want to tackle at the end of the day. I don't know whether you have noticed these particular tweets of mine, but even in the composition of number of foreigners in Malaysia, you can see that the numbers of foreigners have dropped. That has contributed to less cases. But again, we are not sure the statistics of how many tests have been done among foreigners daily. We have the cumulative, but we don't have the daily numbers. I also would like to share this video. So Vance, this particular video basically just shows that we are actually looking at the people who are asymptomatic carriers, and that is my point for today. A lot of people, especially, I think this may apply for Singapore as well, doesn't mean that if you're unwell, you are not having COVID. You may be having the tier 1 COVID, and we're actually worried that these people go out and they actually infect the vulnerable populations, the elderly, those with diabetes, hypertension, and these are the people who get really sick and they end up in the ICU and eventually end up dying. So we should protect all these people. And since you're on the talk of actually talking about pediatrics, I thought that I would share something just really very quickly. Trust me, it will take less than 2 minutes.
Okay.
So do you see my, oh, I think you don't, one moment. I'm so sorry. Okay. So as you can see, I will just I'll just talk about COVID in schools. So basically, how long are we going to keep our kids away from schools? So basically, we can actually start sending our kids to school again if we can maintain SOPs. And one of the basic things which we actually have to do is hygiene and daily practices. I don't think it's only the kids that are problem. The problem should be also with adults who are going there, the workers, the teachers, the gardeners, all these other people. So there's a whole team which actually are involved in this particular thing. And the main thing we are actually worried about is hand hygiene. And Praveen actually pointed out very, very well that we have to mask. I don't know why. I think we should pursue this even more in schools. And I don't think it should be actually cloth masks anymore. We have already seen where spread happens with cloth mask. And as I told you when mentioned before earlier, very, very early in March, that surgical masks are the way to go. And I think it should be provided, the provision should be given by the Ministry of Education. Of course, limiting the number of students in class, some of the ways, limiting mixing of classes of age group. But nowadays, we are taking everything online, but we keep forgetting that some of the students, especially in East Malaysia, don't have the infrastructure. I think we still have to resort into going back to schools, but I think physical distancing, maintaining at least 1 meter distance, proper air ventilation in the class before and after using is quite important. And of course, usage of masks in school and ventilation, especially to increase the air supply up to 100%. I think the use of air conditions at this particular moment is not very wise. So I just have a quick infographic here. Basically, stay at home and self-isolate if you're unwell or if you're exposed. A lot of people very funnily come up and say, "Oh, I've been exposed to one particular person. They straight away go and do a swab test." It's not the way. It doesn't work that way. There's an incubation period, so there's at least a 3 or 4 or 5 day. But the most important thing is, if a person is unwell, ask them to stay away from their kids, ask them to stay away from the elderly, because you don't want to infect these vulnerable groups. So, Vance, I won't bore you guys with more graphs or statistics. That's the COVID update from me. Any questions, I'll be happy to take as well.
Thank you, doctor. Thank you. Because as a GP, you're also in the front line in Malaysia, where you'll be also be helping the pediatrics and even other doctors as well. Because the first thing they come is GP, and then from there, then you, point fingers, or rather not point fingers, channel them to the specialized expertise, right? But I got a question for right now for Dr. Parveen. We have a question that came in. Does using Panadol, I think she's asking more for general, but I think I will pass it to you because since that was a topic we are talking about. Does using Panadol over an extended period of time have side effects, for example, loss of hearing? Because probably you have mentioned just now that any medicine can lead to the adverse reverse results. So what is your take on that, doctor?
So that's a good question. Actually, most of the time when I see patients, children who take too much paracetamol or Panadol, they tend to get liver problems. So the side effects, hearing problems. Actually, I don't. As far as I know, it's not very common to get hearing problems from taking Panadol. There's another medicine called aspirin, which is used for fever and all that. That sometimes you can get hearing problems. Panadol, the most common problem is actually liver failure. You take too much Panadol within a short period, or you take too much Panadol for a few days, you can get liver problems. Then that can be actually very dangerous. So it's important to just take the right dose. And for children, make sure that Panadol container is kept locked up in a cupboard somewhere. Don't let the children go and drink the whole bottle, because once they do that, it can be very dangerous.
Thank you, doctor. Thank you for that question. I think she was asking about that for herself. Probably not, right? If as much as possible, always take medications under the guidance of a doctor, right? That's the reason why these folks have studied for more than 5 years, and they're still studying, and they're still studying, and the studying will be forever, right? There's never an end for a doctor for saying that I have reached the platform where I am the expert now.
Huge books.
That is what, about 5 kg? I think you can use it for your dumbbells,
Yeah, I think you throw it, you can probably kill some COVID.
No, you throw that on the dog will need a CT scan.
Arvind, can I ask you a question, Arvind?
Sure.
What do you think about school closures? Do you think it's necessary to close schools during this COVID pandemic, or would it be better to keep the schools open?
The answer is yes and no. Yes, why they should be closed is because I think the SOPs at the moment has very poor adherence. We have to mass screen. If you remember that Singapore, they did a mass screening before they actually went and reopened schools again. And I thought that was a brilliant idea. Unfortunately, I think maybe another unfortunate probably has escaped many people's attention that teachers are also frontliners. Teachers are going to use the public transport. They're going to travel. They're going to come to schools. They're going to meet the children. They're going to go back again. They're going to be interacting with people and going back. A lot of people forget that there are gardeners in school. There's the canteen operators. There's a bookshop seller. There is, there are multiple other people. Some schools, they have like 2 3 schools in one particular school. The teachers will be mixing again with each other. They use the same compound and facilities. The reason why I say that schools should be closed at the moment is we have to tackle these particular issues, whether we can actually make sure that our kids go back to school knowing that their environment has people who are regularly screened, but know why they shouldn't be closed. Because I remember, and this I would like to quote Dr. Mazli Malik, our former Minister of Education, who has spoken quite a bit um, during this COVID pandemic, and I follow his talks, and I seem to realize that a lot of them who are saying that the 3 months which the MCO, the first MCO which we faced, the kids have already been set back by about a year. The 3 months is set back to a year. I really honestly fear that with our kids, we have not seen the end of this COVID pandemic effect. I think in a couple of years to come, you will find, hey, how come this kid is already like 12, and the knowledge level of this particular kid, an average kid, would have dropped slightly because of perhaps lack of exposure. And I think our kids will be missing out a lot, especially where human contact is concerned. It is going to be a new world right now, but I think education shouldn't stop. It's very sad that education stops because everything is taken on online platform. It shouldn't happen at this day and age, but unfortunately, because of the divide of our social economic status in this country, we are seeing that disheartening to see people uh, uh, going through so much of difficulty just to get internet access to attend class, and that also university class. I can only imagine what the primary and secondary kids are undergoing.
You know, I just give you a quick update on Singapore, right? If let's say if someone is walking without a mask, I think he's going to be in a great danger immediately, right? One, you can be feel that you are top of the world and you don't want to wear a mask. Immediately, actions will be taken against you. You can be a top superior, inferior. You can be left. You can right. You can be Mr. Famous or Mr. Non-famous. Doesn't matter, right? And also, we also impose what we call the safe ambassadors. And these guys are actually walking all around to make sure that constant reminders are there. And even I myself personally saw that if someone is not wearing a mask for some reason, they immediately hand over a mask to them, right? And it has come like a norm, like what you both have said, right? The other day I went to a petrol station, and I don't know what exactly happened. I feel so comfortable, and I walked in, and then I realized my mask wasn't there on my face.
Oh.
So I really panicked. The first thing we nowadays we say, "Oh shit!" That's the first thing. Before run, I don't even want to run out. I saw a mask, I bought it, I tear it, and I wear it. So it becomes like a norm right now. And God knows how many years we're going to wear masks, right? And to think about it, doctors wear that day in, day out. So for you, this is like a common thing for you, right? You don't feel anything.
I used to work in the surgical department, and I used to be in the OT for long hours. So when people say that if you wear mask for very long hours, you get brain damage, my CT scan is not one which Praveen wants to look at. So I think there is no truth in that. I think it becomes a norm. As you say that sooner or later, I think you will feel awkward. Like many years ago, when I think this part of the world where we were still not very advanced, not wearing a shirt and walking around outside was quite common. Especially among the farmers, among the people. I think it was quite common then. But now, if you try and pull off a stunt like that, you'll be behind bars. So I think it has become a new norm, and I think the masks are heading towards that direction. We all think about COVID-19, but remember, many years ago, we didn't deal with COVID-19. We were dealing with Ebola. We were dealing with MERS-CoV. Sooner or later, unfortunately, like it or not, there will be another new virus that emerges, and again, we will have to combat. So I think the reason why people are asking to mask, social distance, wash your hands now is because you don't want the spread to happen. The virus inoculates, it dies there itself, and the story ends there. So yeah.
Thank you, Doctor. Thank you. So we have another question to come in, but Dr. Arinda, I'm going to ask you a question also later on, because as common people, apart from going to specialize, and I mean, you also been specialized in certain areas, but I know right now you're doing more as a GP, right, Doctor? Am I right to say that?
I'm not a GP. I'm in primary care, bro.
Okay, primary care, right? So later I'll give you a few questions that's coming up, but let's ask Dr. Praveen. Dr. Praveen, Dr. Vidya, Vidya has said that, doctors, what are your thoughts on the COVID vaccination? Is it advisable for children to have it? What are the possible side effects for children? So maybe Dr. Praveen can take that, then followed by Dr. Arinda.
Okay. Thanks. That's a good question. As far as I know, the vaccines are not really licensed for use in children at the moment. There's still trials going on, and in some countries, children are being given the vaccine as part of a trial. So if those trials show that the vaccine is safe, it's effective, then later on they might say it's okay to give the vaccine to all children. But for now, at least in Malaysia, there's no rule for vaccinating children with the COVID vaccine. We give it to the adults where we know pretty much that it's quite safe, it's quite effective, and it'll protect the people who are more likely to get severe illness. Since the beginning, sorry?
Sorry, and also it depends on country to country, right? Certain countries have their own protocols, they have their own scientists, and they say that, it's perfectly fine. And I'm sure they have done research day and in, day out, like 24 hours, going through every possibilities and every angle of areas of the risk factors. I'm sure they have done that. Thank you, Dr. Praveen. And Dr. Arinda, what is your take for this, Doctor?
I am on the same page with Dr. Praveen. Basically, we know that some vaccines have been licensed for 16 and above. Some vaccines have been licensed for 18 and above. And as Dr. Praveen has mentioned, I think there are clinical trials now for those 12 and above. But of course, we don't have data to see how the vaccines are reacting. I don't think that the side effects are the main concerns. I think the bigger question here is the efficacy rate, and whether we have to give them the same dose. Of course, there will be a lot of pharmacokinetics and pharmacodynamics to be done. Is where they take the blood and measure whether the immune response is overly responded, or what is the exact dose for it. Just to share with you, when you give paracetamol to a child and you give paracetamol to an adult, the dosing is very different. So I think, in fact, in some terms of vaccine, they want to see whether there's any difference. There's some vaccines where the dosage is the same, or the amount which is given is the same. One of the vaccines which actually differs is, if I'm not mistaken, hepatitis B to be exact, where an adult may require 2 vials of this particular doses, or 20 micrograms, and the child only requires half of it. And of course, it differs from brand to brand again. But I think the bigger question here is not whether there is a reaction. I think the bigger question here is efficacy. I would like to think that there is efficacy, but of course we need to undergo through all the regulatory bodies. We have to make sure that we have data. We can sit here and talk about all day that, there's no side effects, but we need the data to actually show. So I think that is where the countries are all running. Singapore has decided to go with the data which had come from the United States, and I think the FDA, if I'm not mistaken, not approved, but they have cleared the data. So I think at the end of the day, it depends from country to country, and again, it depends on the policy makers whether they agree to accept. Honestly, I sincerely hope that the vaccine is applicable to kids, especially certain brands more than the other, because the efficacy has shown that it is very or it's potent against the UK strain, which I think there's one which is going about the UK now, and the South African strain. So I think certain vaccines have more efficacy towards certain strains. We have to be prepared for everything. So hopefully that the vaccines come through, and even for our kids.
Thank you, Doctor. Thank you. We also have a more messages that came in. Well said, lost generation equal to what happened in Japan by Ramesh. Thank you, Ramesh. There are many messages that came in, but I think we have to always set up a time, and we all need some rest as well. Thank you so much. Once again, thank you so much for the viewers. I know more viewers are coming in right now. I think this is a very great topic, but we have covered as much as possible. We talked about kids and infants, and what kind of stages, what kind of enzymes or plausibility of food, allergies. Always good to go and check with the doctors. But let's get the final words from the doctors before we call it off for the day. So, Dr. Parveen, your advice for a parent who have, or parents want to be, or parents going to be, what is your advice, sir?
So I'd say just trust your instincts. If you're worried about your child, the safest thing to do is get some advice, call somebody with some experience, and make sure your child is safe. When you need help, just call for help.
Thank you, doctor. Thank you, Dr. Praveen. How about Dr. Arvinda?
Well, I agree with Dr. Praveen. I think also one more component which we shouldn't forget about our kids is mental health, especially in our adolescents and teenagers. It is becoming a worrying figure, I think, anywhere in the world, especially with now where we are going, and we are not going online anymore. We are living online. Remember, Vance? We spoke about it the other time. We're living now online. So I think parents should be more intuitive to see how their children are behaving online, whether it's for the good, or in fact, are they becoming victims, or are they victimizing other people? And I think the mental health component in child health is good, but I think there's much more room for improvement, and parents can play a vital role.
Thank you to Dr. Parveen and Dr. Arvinda for coming on a late show, especially Dr. Parveen. 2 days back we talked about this, and we want to make sure that we cover all the topics. But of course, despite having a tight schedule for yourself as the only pediatrician in your state at the moment, and trying to taking care of all the kids and children, and so Dr. Arvinda, your statistics are great. I've been watching that in Twitter and all these informations on LinkedIn as well. So for those who can also follow Dr. Arvinda's LinkedIn. Dr. Arvinda, do you want to give your LinkedIn address so that our viewers can follow you up as well?
Sure. I think I have a slide. My first slide always has that. Yeah, just one moment now. I have it here.
And also for Dr. Praveen's, you can also follow Dr. Praveen's Facebook address. Doctor, what is your Facebook address, Dr. Praveen?
I think it's Praveen Vasandan.
Okay, Praveen Vasandan, you can actually look for him. And he's also been tagged, so you can also get all these information from there. And to the constant messages for the viewers, thank you very much. We are always been blessed to have all this information given at this point of time. Here is Dr. Arvinda's LinkedIn address, so which I'm going to flash it out in a while. Let's take away the joining. Yep, there you go. So you can actually see all Dr. Arvinda's Twitter, where all these statistics have been posted there, and even his LinkedIn, Dr. A. Singh R, right? They can get connected with him, and then with all the informations to be shared, right? Thank you, doctors. Thank you so much. We will stay connected. More interesting topic to come along, Dr. Arvinda. It's always a pleasure to come in and give us a COVID status. COVID should be afraid of you right now, because you are with all the statistics. COVID will be like, oh no, Dr. Arvinda is here right now. Thank you so much once again. I will catch you all up offline, and we will discuss more further about our talk sessions that we have done today. Thank you so much again. Thank you so much, guys. Thank you, Doctor.
Thank you.
And also thank you so much, Dr. Praveen. And thank you so much, viewers. It's been, again, a pleasure for having every one of you all here at Kopi with Vance. And I got to thank each and every one of you with the